morning and welcome to ETX Covered. I'm David Lippman. Last week, we looked at the impact of the rising spread of COVID-19 in East Texas. This week, we'll look at the vaccines that could be the light at the end of this long, dark tunnel. Pfizer was first to announce that its vaccine was successful. It claimed to have a 90% efficacy rate. Out of 44,000 participants in its trial, only 94 got COVID-19, and most of them were given a placebo. Moderna was the second company to announce its results. It claimed to be even more effective at 94.5%. Now they're both asking the FDA for emergency use authorization and say they could have tens of millions of doses ready by the end of the year. When the vaccines are approved, there won't be enough for everyone all at once. State health officials will have to decide who should get it first. Well, Texas has put together a panel of experts to guide the commissioner of DSHS. And one of those experts is Dr. Paul McGaha, chair of the Department of Community Health at UT Health Science Center and the Smith County Health Authority. Dr. McGaha, thanks for joining us today.
David, thank you so much. Glad to be here.
How did it come to be that you were picked for this commissioner's vaccine allocation panel?
Well, it just happened as a Smith County Local Health Authority. I am serving in that role since October 1, and they wanted a local health authority on the panel. There are about 12 members on the panel, from elected officials to clinicians, public health officials. And so I was fortunate to be selected and happy to do so, happy to provide any input I can.
And I know you've met as a committee a couple times already. What have the early discussions been like?
It's been very good discussion, and I think, we're talking about basically when the state of Texas receives the vaccine, how it will be distributed to different parts of the state, how that will be allocated, and deciding on the best approach to allocating it to priority populations, especially as those first allocations to Texas.
Do you have any sense yet of how many doses we can expect at a time when these vaccines first start coming out?
We don't know how many now, when precisely, but if you look at various data points and recommendations from CDC to other groups, priority populations initially will be healthcare workers primarily, those on the front lines, really such excellent work, clinicians, nurses and others, EMTs, other people like that in the healthcare profession. They are in any allocation methodology at the top of the list. And then with time, other populations will be included. So I think a goal of the committee is to recommend to the Commissioner of Health for the state of Texas on who gets it first and how much will be available, and to maximize the utilization as fairly and transparently as possible.
And what do you think a timeline would look like from when the doses are first manufactured to being able to get them distributed around the state and then having the first people actually being able to get them?
That's the million-dollar question. That's an excellent question. I know both the Pfizer and Moderna vaccines, which you've been hearing about, their great efficacy, really good news. I think they produced millions of doses already. I think the next challenge will be when will they receive FDA approval in the form of what we call an emergency use authorization. I'm hearing that could be early for one or both of them as the end of this week. It has to go through some other committees, the Advisory Committee on Immunization Practices, namely with CDC, to give a thumbs up blessing. And then it will, it could be, we really don't know when. It could be as early as next month or earlier, potentially. I think we'll be finding out more about that in coming weeks. But it's exciting that we are pretty close to being on the verge of receiving that first vaccine now.
From a logistical standpoint, is it going to matter which company is approved and ready to go first as far as who can get a vaccine?
Yeah, and pardon me for interrupting, but yeah, I mean, there are 5 or 6 vaccines that Operation Warp Speed has been helping underwrite. The 2 initially that are coming out, it appears to be the Pfizer vaccine and the Moderna vaccine. And some of them work differently. These 2 actually They work similarly. They both require 2 doses. For Pfizer, that's day 0 and 21. For Moderna, that's day 0 and day 28. So that's another thing we'll have to factor into the equation. But with 5 to 6 different vaccines, with different storage requirements, with trying to reach populations in need, trying to remember the rural populations, there's so many plates spinning related to this. Hence, the committee is talking about all sorts of those activities and how we can prioritize populations and allocate it fairly. Plus, as we speak, David, thousands of providers across the state of Texas are registering to be a vaccine receipt portal, a vaccine administration site. So that process is going on now. Healthcare providers across the state, hospitals, clinics, pharmacies are readying themselves to receive the vaccine now. So what we want to happen, I think will happen, is the convergence of receipt of the vaccine, the preparation at the end user site for preparing to receive the vaccine and administering the vaccine, and timing that all right for ultimately to protect the citizens of the state of Texas.
And then, aside from the healthcare workers and people at highest risk, are you going to try to distribute the first doses based on geography as well, as far as which regions have the highest case counts?
There will be several allocation parameters: geography, healthcare worker volume, other areas of population focus. And for looking at geography, we don't want to leave out the rural areas, but I think it will be, at the end of the day, a fair and equitable way to distribute it. And initially, the healthcare workers. With time, other priority groups will be added to the list, those with chronic medical conditions, obviously those in long-term care facilities, both workers and patients there. But it will be a few months before we get through the lower volume of vaccine to where we can get to the higher volume of vaccine and just give it to anybody who wants it. It will be all on a voluntary basis if it's under the emergency use authorization parameter. But ultimately, and Dr. Fauci was saying maybe 4 to 5 months, it would be available for the general public. And that is so important. Efficacy studies are good, 90 to 94% on these 2 initial vaccines. I am confident that the safety profiles, after they're completely analyzed, and if it is approved by FDA and by the ACIP, as we call it, that it will be safe and effective for utilization. So I think it's promising. A lot of work needs to be done, but a lot of that work is taking place. It's a high priority for the East Texas area and for the state of Texas.
And we'll continue our conversation with Dr. McGaha in 2 minutes, including what he would tell people who want to know which of those COVID-19 vaccines they should get. That's next. We're back once again with Dr. Paul McGaha talking about the COVID-19 vaccines in development. Well, doctor, if someone was to come up to you and ask you, we have these 2 vaccines, which one should I get? What would you tell them?
That would be a great question. And with these first 2, I would roll up my sleeve for either one, frankly, and really for any of them. I think, they have different mechanisms of action, and I think individuals will need to talk to their clinicians or doctors or others to determine which one to take. I think there'll be a lot of education coming out to the general public in the coming weeks, the near future, along with a lot of education for doctors and nurses and others about the different types and what have you. We have great news on these first 2. We'll be hearing more news about the other 3 or 4 in coming weeks. It's very promising so far. And I think it's a great opportunity. Well, if you put this in historic content, never have vaccines been produced so rapidly. I know that has some people worried that have all the safety steps been followed as they should be. And I think knowing some of the individuals on these review groups who are just outstanding researchers, clinicians, I'm confident they'll make the right decisions and not put the public at risk. And this will be the biggest vaccination campaign we've had since the 50s during the polio vaccination campaign. So obviously with case rates increasing and with hospitalization rates also increasing, this strain on hospital, it can't come any too soon. So we're very excited about the possibility of arriving in the somewhat near future.
Does the panel have a deadline when you have to submit a report to the commissioner, or is it just an ongoing discussion with him?
It's an ongoing discussion. with taking different parameters in place. Every day there's new events. So I think when the committee gets together, they take in the new information that's been distributed to us, and CDC, to the State Health Department, looking at that, gathering that information, presenting it to the group, and then that group comes up with recommendations to present to Commissioner Hiller's staff there in Austin, and moving the process forward from there. And it will be an iterative process. There'll be decisions made in these early weeks as more vaccine comes, where should it go, et cetera, and using an abundance of data, some key staff people, the brain power of the collective group on the panel. I think we'll try to do the best we can to, as judiciously and fairly and transparently, make that process happen. I think that, studies have shown that about slightly over half the people in the United States want to receive the vaccine. And I can understand that there's caution, they don't know about it, they're fearful. But I think as time comes, there'll be a lot more education of the vaccine. We'll know it's effective. I think people, and I encourage more people to look at the facts, consider the efficacy and the effectiveness of the vaccine, and strongly consider that, because if we develop a certain percentage of individuals, say around 70%, who either had the disease or had the immunization, that can create what's called herd immunity, where really it will dampen or slow down or even potentially stop the epidemic from occurring in Texas or the United States. So we'd love to get at least about 70% of the people either vaccinated or who have had the illness. Unfortunately, that number add up to 70%. Then you blunt the spread of the disease to the general public. So that's one thing we're trying to encourage.
Well, Dr. McGaha, thank you so much for being here today.
I'm very happy. I appreciate the opportunity and would love to update you guys as we appreciate you helping spread the word. You're important allies for us in this campaign. So thank you for the opportunity of letting us share what's going on.